Rob Rotchell, you signed the accord to set up the accountable care system, and yet the inquiry panel hasn't even met yet. So what's the point?
Okay, what I've signed the accord today is to move to shadow format. So that gives us a minimum of 1 year to work out the wrinkles and make sure that when we do make the decision to formally move to an ACS, then it'll be a smooth process. So the accord is to move to shadow status, but not the formal conversation that will take place in a year or so's time.
I think many people, though, would have been under the impression that the inquiry panel was going to be allowed to hold its inquiries, was going to make a recommendation, the Health Scrutiny Committee was also going to make a recommendation, and the Cabinet, and possibly even the full Council, would all have a chance to put in their tuppence worth before you got to this stage.
So all those things are going to happen, and they're all important. Absolutely, that's a good process: inquiry, scrutiny, cabinet, and full council. And I know that's going to happen. That won't impact upon the shadow status. There's an awful lot of work that's going to take place to get things in a row. That will inform the ultimate decision, which is when we come into towards the end of the consultation period around shadow status, formal status. That's when all that information will be taken into account before the final decision is made.
In that case, either aren't these inquiry panel hearings happening too late or too early?
I don't think so. I think there's an awful lot of work that needs to go on with aligning health and social care, and that can't stop. We need that to keep going. But I think the key thing is that the ultimate decision will be made after the recommendation of the inquiry and scrutiny and cabinet are taken into consideration.
What about public consultation? The council has done no public consultation so far.
At this stage, today I've signed the accord to move to shadow status, so those conversations can continue, or commence rather, from now on, because we've got a minimum of a year, and let's not forget, in shadow, so there's plenty of time to have those conversations and make sure the facts get out there, exactly what it is we're doing.
So the council will be doing a public consultation, will it?
It wouldn't be in our interest not to do that. I mean, it's a kind of roundabout answer, but yes, I believe that's the right way.
Because the only public consultation there's been so far has been the one conducted by the National Health Service within the Sustainability and Transformation Plan. Yeah. And that public consultation, as you will recall, only 9 months ago, was not fit for purpose. So if it was not fit for purpose 9 months ago, why are you signing these papers today?
The consultation that took place by the NHS was about the NHS. I think there's a subtle difference now. This is bringing the local authority much more into the equation. So we, as an authority, with democratically elected members, debates take place in the chamber, so it's not in our interest not to have a public debate about it. You're right, absolutely. I was very critical of the STP business case preparation, quite rightly, that I believe the consultation wasn't good, but that was about the NHS, and I think this time it's different.
So you've not changed your mind?
No, at all.
Okay. Now, you've repeatedly assured us that this whole process is not about privatising the National Health Service. You do know, though, that the springboard, really, from which this all started at the beginning of the year was when an American-based firm of private consultants sat down in secret with National Health Service managers and drew up a blueprint about what the future of healthcare in Cornwall was going to look like. One of the options and scenarios that they put in their report does not include NHS England. Now, if it looks like an American private firm initiative and it talks about does not include NHS England, you can understand why people are, at the very least, very nervous.
Indeed. But I've been in this game long enough to remember when an NHS Trust was set up. And in fact, I was an executive director in the first wave of NHS Trust. And the same kind of conversations were taking place then. What I know about the conversations taking place now is that the discussions are taking place between RCHT, CPFT, an clinical commissioning group and the local authority. There have been no conversations whatsoever with private companies or private organisations. What we're proposing is a closer partnership working between those four groups. So as far as I'm concerned, I understand the background and I get what
I mean, it's not quite right to say there have been no conversations with American private companies. Clearly there have. They've produced the blueprint.
But in terms of Cornwall's ACS, there haven't been. And that's a really important fact, that the conversations are taking place between the two provider units, the commissioning group and the local authority for Cornwall.
I accept that since you became the portfolio holder, that's correct. But before then, there have been a lot of meetings going on behind closed doors, and they have involved private companies, and that's one of the reasons why health campaigners, that's why we've got protesters outside County Hall, and why people are now very worried.
I understand that, and, I'm not a poacher turned gamekeeper. I remember when I was chair of scrutiny, I was critical of that process. All I can talk about is, on my watch, that the Transformation Board is going to have its meetings in public. I'm not sure how instrumental I was, particularly in dealing with that, but it's a fact that they are much more transparent now. And that's the way that I go about doing my business. So in terms of the ACS, that will be the way that we move forward.
Once it's up and running, what's it going to look like? Will it be rebranded? Will the staff be working for a new organisation? And will they get paid the same terms and conditions that they get in the NHS at the moment?
I think it's common knowledge that RCHT and CPFT were having conversations about working much closer together well before we talked about ACS and STP, in fact. So that conversation about having a Cornwall provider was well advanced, and that work's going to continue. So in terms of what will that provider unit look like, I suspect it will be rebranded as a Cornwall Health Partnership, whatever. That's for them to decide. Currently their terms and conditions of service are the same. Similarly, those people employed by the local authority, their terms and conditions will remain the same as well. Ultimately, maybe in the future, that is a conversation that I'm sure will take place about generic terms and conditions of service. But again, I can reflect back to when NHS trusts were formed. There was an opportunity for trusts to go their own way, and 90+% of them didn't. They stuck with the old Whitley Council terms and conditions of service.
The strategy documents that have been published talk about a more flexible workforce.
Yeah.
You can understand why the trade unions in the health service are perhaps a little bit nervous about that. How much more flexible do they need to be?
Well, I think they can be, and I think we've proven that. For example, with the issue that we had with delayed transfers of care, and it was a shared problem. Beds at Trelisk were full, and we weren't able to provide packages of care. So working together, we've employed between us 48 generic support workers. So the agreement is with RCHT. CPFT employ the people and we pay the wages. So there is that collaborative working successfully happening today. So I see that perhaps more like that in the future. But even the way that people operate, so that we have a single professional going into the house with a shared assessment that makes things much more pain-free for the patient who's travelling through the health and social care system.
Now, some people have said that this is Cornwall Council taking over the National Health Service, and clearly the council is going to be sitting at the top of a new commissioning structure. Indeed, there's going to be a single commissioner. That's the job title, single commissioner.
Indeed.
And it's going to be the chief executive of Cornwall Council. Now, that looks very much like a takeover. I understand the need perhaps for some diplomatic language to avoid ruffled feathers in the NHS, but you are taking over the NHS.
The bit that will become the responsibility of the local authority, if all goes to plan, would be the commissioning. So the provision of healthcare will remain with the provider units, which are entirely NHS. So the commissioning part, which is currently done by Colonel Clinical Commissioning Group, the proposal is to move that under the auspices of the local authority. But the provision of healthcare will entirely stay with the provider units.
Okay, so the local authority is taking over from the Colonel Commissioning.
That's the proposal, yes. So bring them under our auspices. Because one of the interesting things about that is the degree of governance radically changes because the system we have with our health scrutiny and our governance arrangements, plus the fact we've got 123 elected members who are democratically accountable. So again, that shifts the emphasis in terms of much greater governance.
What will you be able to do once you're in the commissioning hot seat, as it were? I mean, will you be able to save the cottage hospitals, which are currently under threat? 3 of them closed already. Will you be able to do more imaginative things, perhaps, like reduce or maybe even get rid of car parking charges at Trelisk? Just how much authority and discretion to make it a uniquely Cornish health service will you have?
Okay, I think there are two strands of commissioning, the strategic commissioning and the tactical commissioning. The tactical commissioning is what operations take place in one hospital. That will remain with the provider units. But working with public health, which is part of the local authority, then that's a different method of commissioning, more strategic. So it's looking at overall health improvements and health gains, for example, in obesity, diabetes, things like that. So we will set the overall strategy for dealing with that, which we will pay for, but the tactical decisions in terms of where those things take place will remain within the provider units.
Perhaps the question which I hear more than any other is, in view of the concerns about this, including legal challenges, which are being promoted by some quite famous people like Professor Alison Pollock and Professor Stephen Hawking, why not wait until those challenges have run their course? And why does Cornwall need to leap in and be, have this in shadow form in April and have the whole thing up and running fully in only 12 months' time? What's the rush?
Okay, there's not a rush. We're moving to shadow format. That gives us a cushion of a minimum of a year. We're not at the forefront of this. There are other parts of the country that are significantly further in advance to Cornwall. But I think what's commonly accepted is we cannot continue to do what we do in the same way that we do it. So what this is allowing us to do is to do things slightly differently, to work much closer with our party. And I guess, rather than ACO or ACS, I think of accountable care partnerships is a better phrase. It's about bringing people much closer together and working in alignment, whereas maybe that's not quite the case now. So we've still got a year of shadow, minimum of a year of shadow form. So if those challenges, whatever they are, if they manifest themselves in stop doing what you're doing, then there is still time to do that.
Well, I mean, it would be illegal, wouldn't it? I mean, if it's only going to take a judge to say, I agree with Stephen Hawking and I don't agree with Jeremy Hunt,
yes.
and the whole thing in Cornwall comes crashing to a halt anyway. So.
Absolutely, but I mean, but if we're in shadow format, then the impact is less great than if we were saying from April 1st we're going into it lock, stock and barrel, and then the decisions made subsequent to that, then that would be very different. But I think in shadow format, there is the opportunity to stop or pause and take stock of what the judicial decisions are.
Last question, because it's really fascinated me ever since I stumbled across this little nugget in the strategy papers. A big part of the strategy going forward is prevention is better than cure.
Yeah.
And so there are new targets for reducing childhood obesity, for example, and reducing smoking, and best of all, minimum alcohol pricing. Now, there is a national debate about minimum alcohol pricing. Scotland and Wales have expressed interests and so on and so forth.
Yes.
For Cornwall, though, to have minimum alcohol pricing, you can see the problem. I mean, people will be going on booze cruises to Plymouth or to Bideford. How much thought has gone into minimum alcohol pricing for Cornwall?
I think overall, as a national strategy, it makes sense. But part of this accountable care partnership is to say what's fit for Cornwall. But I think you need to, if you put it in the context of all the other things as well. So, the work needs to be done. How can we do it? Do we do it, in fact? Or should we concentrate more on childhood obesity and things like that? So the essence will be investing in early life so that maybe we don't get to a reliance on alcohol later in life. So I guess that's where I would like to see the work being put into, rather than saying let's charge an extra £5 a can of lager.
Well, exactly.
I don't think those conversations have even begun to happen yet. But I think as a part of an overall health and well-being strategy, it's entirely appropriate we do look at it. Yes.
Well, somebody's talking about it because it's found its way into the public domain from official strategy papers.
Yes.
So if you're going to be sitting in the commissioning hot seat,
Yep.
would you commission studies on how we do minimum alcohol pricing?
We would have to. We'd have to. But I wouldn't want to emphasise that over things like diabetes issues and the obesity issues. I think as part of a Cornwall health and wellbeing strategy, that's one of the strands that we'd have to focus on, yes.